Hello everyone, it is David Moreno here, and I'm here to give you a knee pain protocol. This is a series of exercise that I've put together from my observances as a physical therapy technician and seeing what the physical therapists have prescribed for patients in the field. And again, by no means, I'm not a physical therapist. If you're having real aches and pains, please go see somebody that is actually licensed to diagnose you. These are just something that if I'm having myself a little bit of knee pain, this is my protocol that I go through.
First exercise I have here is psoas release, as seen in the photo on the right. A big hip flexor muscle that when tight can cause misalignment in the hips, and definitely if you compensate one side over the other. So what I'm using here is a kettlebell to just dig the edge right into that psoas, to tack it down, and as you see, I'm threading in and out with the same side leg. If you don't have a kettlebell accessible to you, I'm using a peanut, 2 lacrosse balls taped together, and a yoga block, or you can even use textbooks, and I'm just laying right on top of it and using my glutes to relax that psoas even more as I'm digging in. Next up, I'm going to clear my pelvis using the yoga block and making sure I'm bracing my core, lifting up into a bridge. And to actually clear the pelvis, you're going to squeeze the block between your legs. You may feel what's called a capitation or a pop. It's absolutely normal, just getting the hips back into alignment. Next up, we have a couch stretch, looking at targeting the quads. So I'm going to post the back foot up, keep the knee down, and the goal is to keep the trunk as upright as possible, which I'm using my mace for, and squeezing that same side glute. Next up, we have a talar mob. As the name suggests, we're working on the talus, which, as shown in the photo, is a bone that sits at the junction of the ankle. So what we're doing is propping the foot up and having a band right at the crease of our ankle, and you're going in and out of flexion, just as I'm showing you here, going left, forward, and right for about 10 reps each. The goal is to ensure that the talus hasn't slipped and thus affecting our gait. Lastly, I have a plantar fascial roll using a lacrosse ball, and I'm sitting at certain spots that I find are tender and just splaying my feet or wiggling my toes, just making it active as I'm rolling back and forth for a minute and hitting both sides.
Well, there you have it. That is my knee pain protocol. Hopefully this information is of some use to you. If it is, comment, like, subscribe down below for more content like this. This is, again, information that I've gotten from observing physical therapists that specialize in manual therapy, and these are actual exercises that I use in my routine. Hopefully they work for you. Like and subscribe, and as always, I'm your friend in strength, David.